G'day, my name's Jeanette Lowe and I'm going to share our story of working with the community to empower them to make changes to the environment and the system so that the healthy choice becomes the easy choice and in effect address childhood obesity. Our story is based in 2 communities in rural Victoria and Australia. So why did we involve the community in the first place? We had a good history of partnering together as agencies and working particularly on obesity prevention together. And although we were working hard, we recognised that we weren't seeing any results at a population level. We'd also grown tired of short-term funding projects that came with many strings attached and had limited sustainability. What we were doing was clearly not working, and we agreed we had to do something different. We also knew that we couldn't wait for government or anyone else to come and fix our problems. And fundamentally, as a community, we were part of creating the problem, so it made sense that we also needed to be part of the solution. So what did we do? We first had to find a new partner who could help us. We found the team at GLOBE, which is the Global Obesity Centre at Deakin University, who had a lot of previous experience in community-led approaches in obesity prevention. Our existing local partnerships agreed to stop what we were doing and reorientate existing staff to work in this new way. We then presented powerful local data to community leaders from across health, local government, sporting, media, and really leaders that we knew were known change makers and influencers within our community. The rationale behind our approach we also included in the discussion, and we received their buy-in. Then, together, we used our collective relationships and invited people from across targeted settings that influence childhood obesity. But we also wanted to include the general public, and we invited them to attend a 4-hour workshop. This resulted in 160 people attending. At the workshop, we presented the quality data that was collected only 4 months earlier. And this was the first time the community had this level of data at a local scale. The data shocked many of us involved. Participants clearly recognised that we had a problem that needed addressing. To better understand all the drivers behind what causes overweight and obesity, the group then developed a visual map of the factors that influence the weight status of children in the local area and how these factors were connected. This was truly an aha moment. You could see and hear the light bulbs going off around the room. You could hear the murmurings of there's no one silver bullet. All these factors were linked together, and we need to work together as a whole community to change many factors on the map. Finger pointing and blame immediately left the conversation, and this map really helped individuals realise what role they could play in making a difference. So then we moved to thinking about solutions, and the participants were encouraged to develop action ideas to address parts of the system. So then after some theming, they were asked to move to a theme that they felt committed to, that they could contribute to, and those initial ideas were further scoped out and turned into agreed actions to be either undertaken by individuals or in small teams. Ownership of the actions by the community was the key here. There was deliberately no discussion about this feeding into writing a strategy or a plan, as the focus was on the community taking action, and we didn't want to create barriers or delays in this. These were the initiating workshops that created a real buzz in the community. And then, over the next 2 years, we used social media, marketing, one-on-one support, and further workshops in specific parts of the community to strategically grow and maintain momentum. What have we achieved so far? I'll just give you a demonstration using the Generate Change results over the last 2 years. So we started with 160 active participants at the initial workshops, and by 2017 we've grown that to 1,200 active participants. From the workshops, we commenced with 51 action ideas, and now we know of at least 150 actions actually implemented by the community within the community, and they're represented by yellow dots on this systems map. So as an example of some of those changes, from the first workshops, one of the canteen managers from the local secondary school went back and just removed sugary drinks immediately from the canteen fridge. We've had the first hospital in Australia to remove sugary drinks from sale from within the hospital campus. The local water board has constructed 3 new drinking fountains within the town, and the local basketball competition has implemented a water-only policy at the basketball. And these are just an example of a few actions that have gone on. We're also very excited to be able to say that over the 2-year period from children in the same schools, we've seen improvements in the level of physical activity, sugary drinks, active transport and fruit and vegetable consumption. And what's also even more exciting is that we're actually also seeing that the BMI levels are moving in the right direction as well. We've had similar results in Portland over the same period of time. And it's really important to remember that these great results have all been achieved through the local community making many changes, big and small, resulting in a real difference to our kids' health. We've learnt a lot on our journey so far. I now wholeheartedly believe that the community is the key to the solution to obesity. And this is because the community controls so many levers in the system, and they're the ones that have the power to change it. Empowering the community means giving control to the community. And this can sometimes make people in positions of power, or even people like myself, feel very uncomfortable. It's the role of best evidence is also challenged in this kind of approach, and the need for long-term action plans is diminished in this very organic and adaptive way of working. Giving control to the community also pushes back against many of the policies and practices and systems that government in particular has put in place. I truly believe never underestimate the power of community. We've found that when provided with the information, support and knowledge, it's truly amazing what the community can achieve. And this is why we've decided that in all of our work in addressing social complex issues, that we'll be empowering the community to be the solution. That's a summary of our story so far. Feel free to email me with any questions, or for more information, look on our website or social media accounts for our 2 communities. Thank you.